into some kind of a concluding form. Deb.
Look, I've found today fabulous, and I think it actually even started with Jamie at the beginning talking about connection. And I saw today very much about connection, both internationally and locally. And strategically, we look at being, global leaders with our local partners. And I think today you could see that really strongly. We have so many opportunities in oral health before us now, and I'm hoping that a lot of the work Stephen was just talking about, there will be another opportunity that we have to deal with in the future. Although tomorrow probably wouldn't be a good idea on top of the school van, but if it is, we'll take it. And while Stephen and I might have slightly different views about how we get there, it is all about trying to improve the opportunities and the oral health outcomes for our community and to bring oral health into the mouth. Stephen's paper, if you actually get the opportunity to look at it, has really a lot of really good evidence, and today was about evidence matters. And there's a lot of evidence in there, some that I haven't seen, and I pour through a lot of the evidence, and a number of you here do as well. So please go and read it, because there's things in there that I hadn't realised, and it's really useful to use, particularly when you are trying to influence people in that advocacy space, which I know you all do. He presents a lot of evidence and a case for change. And while they are the case for change, I've been trying to push, and I know many of you here have for decades, we are starting to have a voice and people are starting to listen. And I think these are the opportunities we need to take. And this sort of day is a day of pulling it all together and being able to share ideas. And while we might not always agree with everything we hear, that's actually really good. That forces us to think and be in different spaces. And I think when you hear some of the stuff that came from Jan today, where you could see that for kids there's 3 different treatment options ranging from pure prevention to conventional, and no real difference in the outcomes over quite a long period of time. It sort of makes you think, well, why would I go and do all of that really complicated stuff that kids end up being quite scarred about having done, when in fact I'm not going to get any different outcome. And we're hoping that a lot of the work we do with ICHOM will start to help develop up a set of data that we can actually do what Stephen says he can't find, and there's a weak evidence, because there isn't a lot of good health outcome data to show the interventions we do every day actually make a difference. And so I think some of Jan's work is starting to show us or make us challenging some of our thinking. I think Christabel and Louise shared with us the what's actually happening both internationally and nationally and within the state of Victoria in relation to value-based healthcare. And you can hear it's not just us doing it. And while we might be a bit ahead of the pack, there's a lot of people very, very closely behind us, if not in front. And some of the work, I've seen Christabel present a few times over a few years, and it's very different every time I see her. She's just moved on so much further and constantly thinking about how is she going to improve health outcomes for those people that she provides breast surgery to in her team. So, and I think too, as you saw on our value-based healthcare wheel of cheese, and our framework, is we've got a really strong integration section, and the work from Jorg and Ruth really exemplifies that and shows that we aren't just the mouth, we aren't separated from the rest of the body, and we need to be constantly thinking about how we do that. I think the Innovations Cafe was fabulous. I had lots of feedback today about that. And it showed that's all the work that you're doing. And for those of you that don't remember 7 years ago, we started this conference very small, just down the road from the dental hospital. There were probably about a third of you here, if that. And what we did was we were bringing together all the innovations from all of the community health facilities and public health agencies that were doing fabulous things to share their ideas. And look what we've got now, it's just so much bigger and brighter. So I really thank you, because a lot of what goes into value-based healthcare and the new ideas actually comes from the ideas that you have. So I think today was very much about evidence matters, and you saw what we're doing in the hospital with the proof of concept from Sue and Aisha. And they were, while you can see it's still early days, and like all of this value-based healthcare is early days, we accept we don't know all the answers. We haven't got it right. And sometimes I could hear the gasp of people going, an hour to spend with a patient. I mean, we don't normally do that, but when you think about it, if we can invest up front and reduce the amount of long-term poor health outcomes, that's a really good investment. But we've also got to make sure we can do that. This is not about doing something that's much more costly and makes us feel better. It's actually about improving health outcomes. It's bringing the value equation in. It's improving health outcomes at the best cost we can get. So we're still on the journey, you're all on the journey, and you all contribute. And some of you are in front on certain parts of it as well. So today was about evidence matters. I think we saw a lot of it today. It's challenged us. We know that we have some evidence. We want to try and implement it, translate it in less than 17 years, really important thing. But on top of that, we need to also create some new evidence, which we need to do as well. So I implore you to take up all the opportunities because it is up to us to make a difference. It is up to us working with our patients who have been very generous with us to help us pave the way going forward. And so I'm really looking forward to this coming year. We've got a lot to do with our school dental van program, and I'm hoping that Stephen's wrong and it's not the next few years, it's sooner, but you never know. We can always hope, but it is about us all working together on achieving that. I'd like to thank also the people that were involved in organising this with Julie and her team. It's been great. Particularly like to thank Ursula. She's been fabulous as well. So thank you, Ursula. And thank you very much to everybody for coming. I think it's been a great day and I look forward to working with you.